The Federal Health Minister says he has grave concerns about the state of Australia's GP services. Mark Butler will meet medical students and teachers today to discuss how to encourage more medical school graduates to pursue careers as GPs. Political reporter Nour Haydar joins us now from Parliament House in Canberra. Nour, g'day, what can you tell us?
Yeah, good morning, Joe. Well, the Health Minister, Mark Butler, says that general practice has never been in a worse state than it is right now in the 40-year history of Medicare. He says that if urgent action isn't taken to address GP shortages, then it will become more difficult for people to see a doctor. Today, he'll be meeting with medical students, educators and industry professionals to discuss ways to encourage more medical school graduates to choose to specialise in general practice to make it a more appealing career. Mr Butler says that GPs across the country are exhausted and worried about the financial viability of their practices. He's also acknowledged going into this meeting that the shortage of GPs is putting additional strain on our hospital systems. Here's some of what he had to say.
There's a sense that general practice has been run down, and so not only is that placing real pressure on the system today, it is, as you've said, leading young medical graduates to steer away from general practice and into other specialties. I mean, only 1 in 8 medical graduates right now are intending to go into general practice. Not too long ago, that figure was 4 out of every 8 medical graduates. So if it's hard to see a doctor right now, it's going to get much, much harder. And I worry that general practice, as we understand it, really the backbone of Australia's healthcare system, won't be sustainable unless we're able to reverse the trend.
So, Nour, just how significant will this shortfall be if it is not addressed?
Well, we heard there from Mark Butler that only 1 in 8 medical school graduates is choosing to pursue general practice as their career path. If that trend continues, if that downward trend continues, the Australian Medical Students Association says there'll be a shortfall of 11,000 GPs over the next decade. Now, experts say that fewer students are choosing general practice as their speciality because the respect or I guess the reputation of that sort of career path has been eroded over recent years, with GPs facing increasing costs and inadequate Medicare rebates, where also the Australian Medical Students Association says that students are seeing the difficulties that GPs are experiencing within their practices and are instead choosing to go down and specialise in other areas. Now, we know these issues are not new. These shortages in GPs across the country is not a new issue, but has been exacerbated by the COVID pandemic. Of course, in rural and regional areas, there have long been chronic shortages, with some communities struggling to find a GP. The Health Minister, Mark Butler, said that the government's also looking at ways to streamline application processes for overseas GPs who want to work in Australia. He insists that the standards will not be lowered, but says that the application processes are tedious and laborious, and that there are ways to remove red tape around those application processes to allow GPs to work in Australia.
Okay, Nour Haydar there in Canberra.